Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
And welcome back to Life Unrehearsed. I'm Matt Del Vecchio, specializing in life transitions, the senior living industry, and elder care planning. Thanks for joining me on a sunny Sunday afternoon. What a day it was for the IG Wealth Management Walk for Alzheimer's today. So glad they had some super weather. That's a national fundraiser, actually, for Alzheimer's right across the country. And there are plenty of walkers here in Montreal. I saw lots of posts on social media with smiling faces, all for a very good cause for Alzheimer's. You know, as we age, vision impairment and vision loss becomes a serious issue for some. In fact, according to the Canadian Association of Optometrists, more than 2.5 million Canadians have cataracts. That's a significant percentage of older adults and seniors. And there are wide-ranging physical and psychological impacts on seniors' quality of life due to vision issues. Well, I'd like to bring in Dr. Naomi Hasegawa, who is a comprehensive ophthalmologist and cataract surgeon who's been practicing on the West Island for over 20 years. Naomi, welcome to Life Unrehearsed.
Thank you very much, Matt. Thanks for having me. It's a pleasure to be here.
Well, thank you for coming into the studio here on a Sunday with all the traffic and all, but you did it. And really happy you've come in. It's been a while since you are a busy person, and been a while we've tried to get you on the show. So it's such an important topic. As mentioned, cataracts affect more than 2.5 million Canadians. What would you say are some of the signs and symptoms of cataracts?
Well, essentially, a cataract is the clouding of the lens of the eye. And the lens of our eye functions like the lens of a camera. So it focuses the light and the images that enter our eye and allows us to see clearly. So when a cataract develops, it essentially clouds this lens. And so it causes changes in our vision. Most commonly, people complain of things like cloudy or blurred vision. Their colors can look faded or muted. And sometimes they'll complain of having more difficulty seeing or driving at nighttime, seeing street signs, or reading can become more difficult. And halos and glare can often be a big problem, especially with the bright headlights that cars now have.
Yeah, and it must be unnerving for a lot of people if you start seeing these effects. So I'm wondering, if you catch it earlier, can it be corrected with lenses?
It can't be corrected with lenses, but it can be helped with lenses. So basically, as a cataract progresses, it can cause changes in your glasses prescription. Mm-hmm. So early on, people may not have so much difficulty and complaints, but when the cataracts are mild, so sometimes just changing and updating your glasses prescription can help to improve your vision. But the cataracts, unfortunately, regardless, will continue to progress and get worse. And so this improvement with their new glasses is temporary. And when the cataract progresses even more, the prescription changes again. Mm-hmm. So sometimes having to change your glasses prescription frequently can actually be a sign of cataracts. Eventually, the cataract progresses even more and becomes more advanced, so changing the glasses no longer really helps.
Doesn't have the same effect, right? Listening to Life Unrehearsed, and we've got Dr. Naomi Hasegawa in studio with us, and we're talking eye care, and you're specifically cataracts right now. We're going to talk a little bit more about macular degeneration and glaucoma later on. So, okay, we've gone through this process, we've changed the lenses, and now we're reaching the point where the lenses are no longer doing the job, and surgery may be required. I don't know how many surgeries you've done, but over your lifetime, you have done many, I guess in the thousands, I suppose. So can you bring our listeners through the cataract surgery process?
Absolutely. So basically, surgery is really the only way to correct cataracts. You can change the glasses for a certain amount of time, but the only way to really correct the vision is by eventually removing the cataract with surgery. Cataracts won't go away on their own, and they only will continue to get worse with time. So once the decision is made to do cataract surgery, it's essentially a surgery that involves removing the clouded lens or the cataract through a very tiny incision in the eye and replacing it with a clear or artificial lens implant that we call an intraocular lens. So once that decision is made with your doctor, with your ophthalmologist to proceed with cataract surgery, your surgeon needs to organize measurements of the eye with a specific, precise instruments, and this is called a biometry. So these are precise measurements of the eyes that are done with very specialized equipment, and in order to determine the power of the implant, of the intraocular lens that's going to be inserted at the time of surgery. But the cataract surgery itself is an outpatient procedure. It's done in an operating room setting, but under local anesthesia as a day surgery. So you're awake during the surgery. But if necessary, like, we can give a mild sedative to relax you. But many, if not most, patients don't even need a sedation. And so before the surgery, basically, the nurses will put some drops in your eyes to dilate the pupil. And then your surgeon will freeze your eye, usually just with eye drops, freezing drops. So it's very rare that we need to freeze the eye with a needle or an injection. So during the surgery, we ask you not to move, and you'll be looking straight at a bright light from the microscope. And but you won't be able to see any of the surgery itself. So you'll see movements and lights, and some people talk about seeing a fantastic light show. But you don't see instruments coming at your eye, or knives or things like that, or scalpels. The procedure itself lasts about 10 to 20 minutes, depending, and it's painless. Although sometimes you might feel a little bit of pressure during the surgery at certain points throughout the surgery.
I've talked to many people in my world working with seniors and older adults that have had that, and it's kind of this fear and anxiety, which is the unknown, right? So I'm glad you explain it like that, because it really is a relatively painless and quick operation. Do you just do one eye at a time, or can you do both, or what's common?
Historically, it was always one eye at a time. There's risk of infection, there's risk of post-op complications, and so for many years, it was standard procedure to do only one eye at a time. But more recently, and especially because of the pandemic, it has become more common now to actually do bilateral sequential cataract surgery. So both eyes done on the same day, one following the other, one eye first, then the other. And this was originally sort of shied away from because of the risk of infection and other complications, but it's become increasingly popular because patients, it decreases the amount of visits patient has to have. Economically, it's more efficient, and the risk of, with our advanced cataract surgeries now, the risk of complications and big problems post-operatively has really gone way down. So we feel it's a much safer procedure to do that way. However, not all cataract surgeons do this. It's not for everybody either. So the patients have to be selected properly to have both eyes done at the same time. And many times it's still one eye at a time. And it's also surgeon preference. So not all surgeons will do both eyes the same day. Many still do one eye at a time.
Right. Nice to see the progress, though, even with equipment and technology. And speaking of progress, what is the recovery process like?
The recovery process is actually quite easy. Since it's a day surgery under local anesthesia, usually right after the surgery, you're up and about right away, and you go home right after the surgery with a plastic shield over your eye. The vision initially, right after the surgery, is obviously blurry, but usually you can see enough through the shield to get around and function even the first day. The vision will often clear quickly in the initial few days following surgery, and it's often actually quite good within a day or even a few days following the surgery. But I always tell my patients that the speed of visual recovery can vary depending on various factors like the amount of swelling, the amount of ointment in the eye, whether or not it was a difficult surgery, their glasses prescription, all sorts of different things. And it's not necessarily an indication of the success of the surgery if you're not seeing very well very quickly.
And, I mean, success rates are very, very quick. I'm amazed at how quick you can get your vision. I hear, like, oh, my goodness, I wish I did that beforehand. So there is success. You're seeing better. There's a safe factor. There's a confidence factor involved. So a lot of feel-good stories when you're able to get that cataract surgery done. We have to head out to traffic, and we are talking with Dr. Naomi Hasegawa. She's a leading ophthalmologist, and she's providing us some updates on eye care. We're going to switch gears after traffic, Naomi, and we're going to talk a little bit about macular degeneration and glaucoma.
Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
My name is Matt Del Vecchio, and I am talking to Dr. Naomi Hasegawa, a leading ophthalmologist who's providing us with some really excellent information about eye care. And we just talked about cataracts, very encouraging about the progress being made and how quick and painless it can be done and improving the vision of many older adults. Now, we're going to switch gears a bit, Naomi, and I'd like to talk to you a little bit about glaucoma. We hear that. It's probably something you see often. So for our listeners, what is glaucoma?
Well, glaucoma is actually one of the leading causes of blindness in people over age 60. It's actually a disease of the optic nerve. And the optic nerve is essentially the nerve responsible for our vision. The optic nerve transmits the images we see from our eye to the brain. So it's a direct extension of the brain. Glaucoma is actually usually related to pressure inside the eye, high pressure inside the eye, which is known as the intraocular pressure. So normally, intraocular pressure is created by a constant production and drainage of the fluid in the eye called the aqueous humor. So when there's a problem with the drainage of the aqueous humor, the pressure builds up in the eye, resulting in an increased intraocular pressure, and this increased pressure is what damages the optic nerve and can lead to vision loss. So unfortunately, because it's nerve tissue, like the brain, any damage to the optic nerve is irreversible, and so prevention is the key.
So I want to address that. Prevention is the key. So what would be some of the early warning signs? It's like, my goodness, if it's one of these issues that is very hard to correct, it's nerve related, what should we be looking out for?
Well, in order to answer that question as best as I can, I have to distinguish between the two main forms of glaucoma. So namely, there's open-angle glaucoma and angle closure glaucoma. So in angle closure glaucoma, the iris, or the colored part of the eye, can completely close off or block the drainage pathway of the eye. And this leads to a sudden, complete blockage of the drainage of the fluid from the eye, and so it leads to a sudden and severe increase in intraocular pressure. So this is known as an acute attack of angle closure glaucoma.
So when you say pressure, are we talking about like it's pressure in the eye, you're feeling this is painful?
So in this case, with this acute angle closure glaucoma attack, yes, it causes severe, sudden increased pressure, and so severe pain goes along with that sudden increase. So the intraocular pressure becomes exceedingly high and causes this tremendous eye pain, headache, and even causes nausea, vomiting, and blurred vision with halos around lights. And you usually most patients end up in the emergency room because they think their head or eye is going to explode. So it's considered an emergency because optic nerve damage and permanent vision loss can ensue within hours of the problem. But unfortunately, people who are at risk for developing acute attacks of glaucoma don't usually have any symptoms before an attack occurs. So, but luckily, most people at risk can be detected on a routine eye exam. And in those cases, preventative laser treatments can be performed to prevent acute attacks of glaucoma. So it's important to have regular eye checkups, even if you don't have symptoms.
Just on that, what is suggested for older adults? Say some people over 65, once a year? Are we looking at?
Optometrists can do basic screening examinations. So if there are no history of any eye problems and no actual complaints, then usually an annual visit with the optometrist is recommended. And if during those visits the optometrist feels there's a need or a problem that needs to be further evaluated or treated, they can be referred to an ophthalmologist, and the ophthalmologist will determine thereafter the frequency of visits needed. But the more common form of glaucoma, is actually chronic open-angle glaucoma. And in this case, it happens very gradually, where the eye doesn't drain fluid as well as it should. So it's more like a clogged drain rather than a completely blocked drain. So as a result, the intraocular pressure is increased kind of gradually and damages the optic nerve gradually without any pain. And in the early stages, there's actually no symptoms, there's no visual loss, and there's no warning signs. So as the disease progresses, though, it can damage the vision, and blind spots in the vision can start to develop, usually in the periphery. But even then, most people don't notice these early changes in their vision until the damage is quite severe and advanced. So that's why we consider glaucoma a silent disease. Yeah.
And again, all the more reason to get those that eye checkups. And we're slowly running out of time here, but I do want to address macular degeneration as well, Naomi. And we are talking with Dr. Naomi Hasegawa, leading ophthalmologist, about proper eye care. So can you define for us what is macular degeneration?
Macular degeneration, otherwise known as AMD, is one of the most common causes of poor vision in the elderly. It's basically a degeneration of the retina, or the center of the retina, called the macula, where the cells of the retina undergo degenerative changes that essentially affects the central vision. So the central vision, the macula, allows us to see fine details and perform activities such as reading and driving. So when macular degeneration occurs, it breaks down that central vision, and we lose the ability to see clearly for driving, reading, recognizing faces, and looking at details. And there's essentially two types of macular degeneration, wet and the dry form. So the dry form is a more common form where the macula just gets thinner and atrophic and has deposits in it that disrupt the vision. And it tends to progress relatively slowly, but unfortunately there's no known good treatment to prevent that from happening. Wet macular degeneration, on the other hand, is less common but more serious. And in this form, there's abnormal blood vessels that grow underneath the retina and causes leaking and bleeding under the retina, which causes a much more precipitous visual loss and distortion. And if not treated rapidly, it can cause permanent scarring and severe central visual loss.
So, I'd like to, just as we wrap up, very informative, and I think if people are listening today, we've talked about cataracts, we've talked about glaucoma, macular degeneration, some scary terminologies, and it's our eyes. We only have two eyes. So what words of advice can you give to our listeners to take better care of our eyes?
Well, I guess the key word is prevention. As we see here today, some conditions are silent, some conditions progress rapidly. So essentially, go for your regular eye checkups. This can lead to early diagnosis of issues, prevention of disease, and prevention of visual loss. Protecting your eyes from damage, things like if you spend a lot of time in the sun, wear sunglasses, wear protective eyewear if you're doing dangerous activities like grinding, carpentry, playing with chemicals as part of your job, requires protective eyewear to prevent injury. And like in most aspects of healthcare, take care of yourself. Eat well, exercise, treat underlying conditions like diabetes, hypertension, cholesterol. Don't smoke, because all of these things can have both direct and indirect effects on the health of our eyes and our vision.
Great words of advice, and so important. We only have our two eyes. I want to thank you very much, Naomi, for coming in studio here at Life Unrehearsed, and appreciate your time.
Thank you for having me. It's been a pleasure.
All right. That's ophthalmologist Dr. Naomi Hasegawa, very prominent ophthalmologist and very well known, certainly in the West Island. All right. Next week on Life Unrehearsed, we're going to talk about, the world's in crises. Can empathy actually enrich lives? Very interesting author of a book called Purposeful Empathy. And it's ALS Awareness Month. We're going to have the executive director of the ALS Society join me, as well as a gentleman living with ALS for many years and going strong, helping the community. I want to thank you for tuning in to Life Unrehearsed. As a reminder, for all your inquiries or assistance with life transitions, elder care planning, and the senior living industry, it'd be my pleasure to help. You can find out more by looking up Lianas Senior Transition Support. That's Lianas, Lianas, Senior Transition Support. And many thanks to our technical producer extraordinaire, Brian Calasar. Great job, Brian. Thank you very much. You could listen to Life Unrehearsed here on CJD 800 every Sunday at 4 p.m.